Hello and welcome to Anticlock Academy. I am Dr. Krishan Mohan Kapoor, and today we are diving into the concept of pinch anatomy in the temple area and its importance for temple filler injections. Understanding pinch anatomy is crucial for achieving precise and safe results in aesthetic treatments, especially when working with delicate regions like the temple. In this video, we will focus on the temple, an area where both the skin and deeper structures change dramatically during the pinching process. We will explore how knowing these changes can help you perform better filler injections while avoiding complications such as vascular occlusion or nerve injury. Before we get into the specifics of the temple region, let's briefly discuss the concept of pinch anatomy. When performing injectable treatments, injectors typically use their non-dominant hand to pinch or pull the skin while injecting with their dominant hand. This pinching or pulling deforms the skin and subcutaneous tissue, shifting the position of underlying structures such as fat pads, fascia, and blood vessels. This change in the anatomy of the tissue layers is known as pinch anatomy. Pinch anatomy helps create more space between the layers for easier and safer needle or cannula insertion. Understanding how to manipulate these layers through gentle pinches or deep pinches can make a significant difference in the quality and safety of temple filler injections. The temple area is anatomically complex with several tissue layers that are essential for facial contouring. The main layers which are used in pinch anatomy, they include skin, which is the outermost layer providing protection and support. Then we have subcutaneous fat, which lies beneath the skin. This fat layer contributes to the volume and contour of the temple. Next layer is superficial temporal fascia. This fascia covers the superficial temporal artery and helps define the shape of the temple. Next layer is the loose areolar tissue, which lies beneath the superficial temporal fascia. This tissue layer allows the galea aponeurotica in the forehead and temporal fascia to move relative to the underlying deeper tissue. And then deep to the loose areolar tissue, we have deep temporal fascia. When you gently pinch the temple, the superficial tissue layers, including the skin and subcutaneous fat, are compressed and then they move upwards, while the deeper structures like superficial temporal fascia and the vessels, they remain mostly unchanged. This gentle pinch is typically used when injecting into the superficial layer for skin rejuvenation. On the other hand, a deep pinch, also called pinch and pull maneuver, it creates more space by pulling up the skin like this. So skin, subcutaneous fat and superficial temporal fascia along with the superficial temporal artery are pulled, while the deeper structures like the deep temporal fascia, it remains fixed. This creates a larger, safer space for injections. The superficial temporal artery is one of the most important arteries in the temple region. It lies between superficial temporal fascia and supplies blood to the scalp and the lateral part of the forehead. During a gentle pinch, the superficial temporal artery remains relatively undisturbed, as it is located deeper in the superficial temporal fascia, while the skin and subcutaneous tissue, they are pulled upwards. This means that when performing superficial injections in this area, it is crucial to stay cautious and avoid the superficial temporal artery as it remains in its original position in the fascia. However, with a deep pinch, the superficial temporal artery is pulled up with the superficial layers away from its fixed position. This separation allows the injector to place filler in the loose areolar tissue layer between superficial temporal fascia and deep temporal fascia. And this is a relatively avascular space, thus minimizing the risk of injuring the superficial temporal artery and other critical structures. When performing a deep pinch in the temple, the key advantage is that it allows the superficial structures to be separated from the deeper layers. This increases the tissue space and creates an avascular plane that is ideal for safe filler placement. The loose areolar tissue layer that forms beneath the superficial temporal fascia and above the deep temporal fascia is devoid of major arteries, which makes it a safer place for injectables. By using the deep pinch technique, injectors can place the needle or cannula in this loose areolar tissue plane without worrying about injuring vessels like superficial temporal artery or middle temporal vein that runs in a deeper plane. However, it is essential to stay mindful of the temporal branch of facial nerve which runs beneath the superficial temporal fascia. While the deep pinch helps pull the superficial temporal artery away from the injection plane, injectors must still take care not to hit the nerve while injecting. In practical terms, temple filler injections are used to restore volume and contour to the temple area, which can become hollow with age. The deep pinch technique helps injector target the loose areolar tissue layer, where fillers can be injected to lift and contour the area without affecting major arteries or nerves. Here's a quick guide on how pinch anatomy can be applied. First, gentle pinch. When injecting superficially into the temple to treat the skin issues like skin for hydration or rejuvenation, a gentle pinch is best. This maneuver allows injectors to work safely around superficial structures while minimizing vascular risks. And while using deep pinch, for more volume restoration and contouring of the temple, a deep pinch is ideal. By pulling the skin and subcutaneous layers away from the fixed deep fascia, injectors can access the loose areolar tissue space, ensuring the filler is placed in a safe avascular plane. Injectors should also be cautious of the temporal branch of facial nerve, which lies under the superficial temporal fascia. Understanding the precise location and the way the tissues move during pinching allows us for a more controlled and effective approach. To summarize, pinch anatomy of the temple is a crucial concept that allows injectors to perform safer and more effective filler injections. By understanding how the tissue layers shift and the relationship between superficial arteries, nerves, and the loose areolar tissue plane, you can reduce the risk of complications. The deep pinch technique increases space for filler placement in the avascular loose areolar tissue layer, making it the optimal approach for filler rejuvenation and contouring. Knowledge of pinch anatomy enables injectors to avoid vascular structures like the superficial temporal artery and middle temporal vein and provide natural and safe results for the patients. Thank you for watching this. I hope this video on pinch anatomy in the temple has been informative. Don't forget to like, comment, and subscribe for more content on injectable techniques and facial anatomy. See you in the next video.